Well, I appreciate that, Marty. This is a very exciting time for our organization. As Marty mentioned, on the 1st of January 2008, we are launching a new national organization called the Healthcare Communication and Marketing Association. The new organization will represent really all of the constituents in the area of healthcare communication and marketing. On the industry side, looking at pharma, biotech, device and diagnostic, as well as on the service side, certainly with a myriad of service partners, including agencies and publishers and public relations firms and med-ed firms and consultants and all of those who support the industry. We've put together a board of 25 industry leaders who are representative across our membership, both in terms of constituency on both sides, industry and service, as well as geography, as we are truly a new national organization. We have representation on both coasts and, of course, across the country. The wonderful thing is we are building on this wonderful heritage that has been established by the three organizations that come in front of us. And while we're going to utilize that and build off that foundation, we also have some very exciting new offerings that truly represent our industry today and the new organization that it is, including things like distance learning, a very robust web-based educational program, as well as things like customized on-site training, to be able to go to companies and offer them training and education specific to their needs by a group of nationally known education professionals. So it's extremely exciting to have these people in place. And certainly as we have these 25 board members, we also have 11 different committees that are involved in driving the training and the education that is behind the organization, and it will be appropriate for all people in the industry throughout their career growth, from student to CEO. And our hope is that all of you will certainly will participate in this new organization and get involved in some of the excitement with us, whether that be from a membership standpoint. And of course, if you are current members in any of the organizations, you will automatically become a new member of the HCMA. And if you are not a member, in front of you, you will see a membership form in the packet you have. So we'd certainly encourage you to get in touch and to become a member so you can, again, participate in a lot of this activity. At the same time, we would love, we're very much interested in people volunteering. We built a structure that really involves and integrates a lot of different people in industry, and encourage everybody to participate and to volunteer in a myriad of things, across the committees. So again, you can get in touch with some of the staff if you are interested in volunteering, and we'll certainly put you in the right place based on your interests. And certainly, finally, there's also a potential to help us as we launch this new organization and really, become a sponsor and a founding sponsor. And to tell you a little bit more about that and how you can participate, I also want to introduce the new president-elect of the organization, who will be leading it in 2009, Marianne Asinovich from Vision Communications.
Good morning, everyone. To build on Jay's comments, I want to have the opportunity not only to introduce myself to all of you, but also discuss a topic that each one of you know very intimately, and it's you. And I'd like to discuss you, your future, and why your successes truly define the success of the HCMA in the future. First, let's discuss you and your needs. Perhaps it was simply the need for information after such a landmark movie like Sicko, or perhaps it was the first opportunity this year you've had to network with some of your colleagues. As many of us are gathered here today, there are equally as many needs and reasons why we are motivated to be here. As Jay mentioned, the HCMA has been created for you to address your needs and to put you at the forefront both now and in the future. And this segment segues me into our second discussion point, specifically your future. If you were to make a personal investment, you'd want to clearly understand how you can best benefit. And Jay intimated some of those details, but let's dig a little bit further. Through your support of the HCMA, you will help your future, and subsequently the future of all your colleagues sitting around you today. And that happens by creating a new association, by shaping this great industry for the future growth. And having you engaged and having you invested in the HCMA will certainly emerge, as Jay mentioned, to serve more of a national constituency and the needs of that national constituency. And if you ask yourself how, it's very, very simple. By providing access to the most comprehensive offering of educational resources, by standardizing training and accredited programs, through greater networking and mentoring opportunities, and through national recognition of excellence for you and your colleagues today, and most importantly, for our future. When we think of our individual careers and we take pause to think of our every opportunity, our mutual success ultimately advances this great organization and our industry as a whole. The HCMA is not going to be some intangible thing. It is going to be our common bond, and together we will certainly determine the success of HCMA and improve healthcare. So how is this accomplished? Well, if you ask yourself fundamentally, why do people give? We give to causes that match our values. We give to organizations where we trust the leadership. We give to organizations where we've developed a relationship with an organization, and certainly the standing on the shoulders of the giants that went before us is quite important, and the organizations that have went before us. We certainly also give when we have confidence in the future of an organization. But ultimately, each one of us will give because we're asked. So today I'm asking for your help, and I'm asking both for your time and for your money. Collection basket will be passed around. So if you can make an investment, one that could reward individuals and also create value for an entire industry, one that builds momentum and moves us all forward as an industry, I believe we'd all agree that that is certainly a worthwhile investment. So through you and your organization's support of the HCMA, we'll not only realize the value of giving now, but also well into all of our future. So today is a day I share with you that it is today that we take the steps towards building a new organization by what we give. And in turn, through our generosity, we'll build an organization with a clear vision that is dedicated to enhancing and optimizing the careers of its members. So as Jay mentioned, today is definitely a very special day for all of us. The difference we can make is by the value that we create for the future. That's all of our collective future. And this is accomplished specifically by asking your friends and colleagues to join the HCMA, by attending forums like this great meeting today, by taking the initiative to volunteer for the various activities and communities, as Jay mentioned, and as mentioned, by making a financial investment or introducing this opportunity to the respective leaders of your organization. I invite all of you to contact me directly, any of the leads of any of our committees, Jay Bowling, and certainly think about becoming a charter sponsor of the HCMA. I want to thank you for your time. I will be here throughout the meeting today if anyone would like to speak with me, and I would like to wish you and our panel a wonderful meeting. Thank you.
There is a longer version of that talk for those of you who want to stay after the meeting. We really made Mario rush on this. I do want to just give you one more resource to look at, and that is that for all the people who have in fact been working on this project, and there have been many, there is a preliminary website which is up, and that is thehcma.org, and you can get more information there. One other thing I'd like to do is you'll notice the second table back here on my left has a group of people that you may not have seen before at any of these meetings, and that's because they're our scholarship winners and they're sponsors. And we'll be talking more about that at lunch today. Now I'd like to introduce past president of HMC, Peter Frishoff, who has co-chaired today's program along with another past president, Janice Cohen. And Peter is not only a past president, but he is also currently the secretary of HMC, and this year he is chairman, this year, and he is chairman of Crossix Solutions, and for those of you who don't know, he's also a founder of Medscape and SCP Communications. So Peter, why don't you join us?
Thank you, Marty, and good morning. We're very excited about our panel today, and we'll get started in momentarily. I did want to announce we are videotaping this conference, and we would also like to videotape questions from the audience, but if you would rather not have your image or your question, please do say so, but just be aware of that. So, as was mentioned earlier, we are embarking on a program of distance learning, and this today's very informative program could be a first part of that on the web. So without further ado, I'm going to introduce our panel, starting with the gentleman who you see on the screen, who is joining us all the way from Seattle, Washington via the internet, and that is Joe Gifford, who's Senior medical director at Regents Blue Cross Blue Shield, which is the large Blues plan of the Northwest that covers Washington State, Oregon, and environs. Say hello, Joe.
Hi, Peter. Thank you. Happy to be here.
Great. And we have an honorary seat for Michael Moore, just in case he's known to show up late. He was invited. He did say no through his agent, but the debate is healthy, and if he comes, he'll have a chair. But in the event that he doesn't, we have an empty chair for him. John Camp is the executive director of the Coalition for Healthcare Communication. He's a Washington attorney and a real First Amendment advocate who is trying to make sure that both clinicians and consumers are getting all the information that they need in the freest possible way. And to his right and my left is David Merritt, who is with the Center for Health Policy Innovation. Is that?
Health Transformation.
Health Transformation, which is Newt Gingrich's health enterprise in Washington. So he is very much of a health policy wonk for the Newt Gingrich group. And we have another very distinguished wonk to his right. J.D. Kleinke is chairman of the OmniMedics Institute. I'm proud to be a director of that organization. He's a very well-known health economist, Hopkins trained, and an author of 2 very important books, which are mandatory reading for all health policy experts. One was called Bleeding Edge, which was about the managed care transformation, and then a second book called Oxymorons, where he actually took back a lot of things that he said in the first book. And he's a longtime contributing editor to Health Affairs, which is the leading health policy journal as well. And immediately to my left is my friend and longtime colleague who I've known since 1975 when I had hair. Louis Goldfrank. When I first met him, he was working at the emergency service of what the now demolished Morrisania Hospital in the South Bronx, where the emergency service was largely based in a trailer in the parking lot. Give you an idea of what he was up against. The patient population at the time, and this was the 70s when the South Bronx was much more violent and dangerous than it was today. And they saw an average, I believe, of 5 patients a day who were bitten by wild dogs, who were basically guard dogs that were breeding. Is that correct, Louis? Yeah, so actually the good news is while we still have a lot of problems, we don't see those kinds of statistics anymore. So we're very, he's now the Director of Emergency Services at Bellevue, New York University Medical Center. He is the author of the standard text for emergency medicine physicians, toxicologic emergencies, which I'm proud to say started as a series in a magazine that I edited in 1975 when I first met Louis, called Hospital Physician. And it continues to be a bestseller standard reference today. So we all know why we're here. It's to discuss Michael Moore's film, and the format of the presentation is we're going to show a clip from the movie, and followed by a discussion of the panelists. We're not going to have time to do we have excerpted segments which include about 30 minutes of the actual film itself, but computer errors notwithstanding, I may need some technical assistance here. Let's see. Not sure why our video is not coming up. I'm going to just try this. This is okay. So let's see if we have. Better luck this time around. Of course, this is Moore's Law because we were. Okay, I think we're fine. Okay, so the format is going to be, we're going to do little excerpts of the film, and then there's going to be a discussion. And so the first, this is really, we're going to start with the beginning of Sicko, and then we're going to jump around a little. So this is an excerpt which is called Table Saw.
So this is the table.
Okay, so I don't think that's the result that anybody would want. One of the things that we're going to do today, I mean, I was really quite surprised and taken aback. I mean, Moore does have this way of combining comedy and tragedy in a very interesting way. But I've actually never heard of, having known many emergency medicine physicians and people who work in emergency services, I've never seen anybody who was quite offered that choice. And I should actually mention that Joe is not only is a medical director, but he is also an emergency medicine physician. So both he and Lewis have worked in these settings, and I was going to first ask Lewis, have you ever seen anything quite like that in your experience?
I think the point is that the emergency physician wasn't going to reattach those fingers. Those fingers could be reattached by a plastic surgeon. And the patient may very well have asked, what's this going to cost ultimately, or what's going to be covered in the process, and what's the risk? And the arteries and veins and nerves have to be attached, and it's done with a very complex microscopic effort in an operating room, a long period of time, lengthy rehabilitation. So one goes through whether it's useful to reattach those particular tips. In most instances, we probably wouldn't do a number of those. We're the microsurgery center for the city, but we probably wouldn't do some of them based upon the injury. Some we would, depending on what his task was, if he were a great violinist. But we'd make decisions, and I don't think it's, we can look at a table saw, it's very dramatic, but people make decisions routinely based upon what something costs. It's not, which antibiotic can I take, or whether I can take my antibiotics. It's an extrapolation or hyperbole, but it's a daily decision for many people.
Okay, so this, you're saying this in and of itself is not necessarily the indication. There are many others in the film, but this one is not necessarily an indication of a broken healthcare system.
I don't know if that's what I said.
Okay.
Well, so
Joe, go ahead.
So Peter, I with great respect to Lewis, I think it's important to say that this is the start of the fiction in the movie, the pure fiction. If you look at the medical record that's shown, you see that certainly the ring finger is just a laceration of the tip of the finger. In any ER, including Dr. Goldfrank, this would be treated in the ER at a total cost of probably somewhere between $500 and $1,000. So $12,000 to, quote, reattach a wound that has good circulation distally to it, it's pure fiction. In addition, in almost any center that I've ever been in, that amputation of the third finger would not be offered. It's a fairly hopeless surgical procedure, and an amputation at the DIP joint is the standard treatment, and that would probably be accomplished in the ER as well. So this is really the beginning of fiction in the movie.
Okay, Lewis, any comment on that?
Well, I guess I didn't see. I thought that they were both severed, and maybe I didn't see the film effectively. If it's a laceration, then it will certainly be handled differently. But the concept for a cinematic value of making decisions, I thought was useful. Whether I don't think I was able to. I didn't see again the image of the film.
Okay.
I'd add one thing, if I could, to your comment, though, about this being an indication of a broken system. I think at least we're in the ballpark of a broken system. When you look at the issue of medical pricing, the variation between costs from city to city, or even within cities in many cases, is just totally irrational. So I'm not sure, I'm certainly not a doctor, I can't comment on the 12 grand versus 60 grand, but the issue of medical pricing in general is an indication of a completely irrational and broken system. Secretary Leavitt of Health and Human Services in Washington tells a great story where he was trying to be a good consumer and shop for a colonoscopy. He just turned 60, he and his wife were going to get a colonoscopy, good preventive care. And so he decided he was going to shop based on cost and quality. So he went to George Washington Hospital and asked for a price for a colonoscopy. And he was told with Dr. A, it was going to be $6,700. He then went to another insurer and asked for a colonoscopy at GW Hospital. With a different doctor, it was $5,700. So being from Utah, he decided, I'm going to go check out Intermountain Healthcare, which many experts say offers the best care at the lowest cost of any health system in the country. And they offered it for the bargain price of $3,700. But he found out later that if you do it in the outpatient clinic that Intermountain has, it's only $950. So you go from $950 to $6,700 for the same procedure in two different places, which tells you that there's no rationality to the cost of a colonoscopy. And the same thing can be said for many other services. Congressman Paul Ryan, who's the ranking member of the House Budget Committee, held a hearing last year on medical pricing. And in the city of Milwaukee for an open heart surgery, the difference in cost within the same city of Milwaukee was $43,000 at one facility and $106,000 in another for the same procedure. So I think that this certainly is an indication of a broken system. Whether it's the epitome of it, I'm not sure, but it certainly is certainly a symptom.
Okay. Well, I think in the interest of time, we're going to move on. John?
I'll just make one quick point, and I think the premise of the film that one should not put a price on healthcare or parts of one's body is just a silly idea. I mean, we do it. We should put a price. We should make basic decisions on what to do based on cost. Now, it may very well be true that the pricing now is not rational, but the idea that patients themselves have some participation in the decision making based on what they do, based on cost, doesn't seem to me like a radical idea at all in our economic system.
Okay. Well, I think the large part of the movie really focuses on the lack of access to coverage and the lack of universal coverage and the superiority in Moore's view of single-payer systems overseas. And we're going to see a bit of that in the future. But first,